Symptoms in brain tumors is because of two reasons. The one is because the tumor spreads along the tracts in the brain. Like these are tracts which helps carrying the message from the brain to the hands or the legs. The tumor involves these tracts. Patient is going to have a weakness in the hand or the leg, or he has a abnormal sensation in the hand or the leg, or weakness in the face. The second reason for the development of symptoms in brain tumors is because of the mass effect. As the tumor increases in size, this is going to press on to the normal neural tissue. If it is pressing on the functional part of the brain, for example, if the tumor is pressing onto the face area, then he can develop a facial weakness. Or if tumor is involving the speech area, then he can develop a speech disturbances. So similarly, if it's involving the optic tracts, they can develop a visual disturbances. So symptoms are because of these two pathologies. One is because of the involvement of the tracts, second is because of the mass effect. The commonest symptoms in brain tumors is the most common symptoms because of the headache, where because of the pressure, increase in the pressure within the brain, that presses on to the something called as the dura mater covering the brain surface, which is pain sensitive. The second symptom is the seizure, because once a tumor grows in size, it can irritate the normal surrounding brain tissue, leading to the epilepsy or seizure. And depending upon the involvement of the normal tracts or the functional areas of brain, patient can develop either a weakness in the arm or leg, speech disturbances, visual disturbances, weakness in the eyeball movement, or the facial weakness. Apart from these, once in a while, sudden bleed within the tumor, which can land patient in a very bad state, leading with a sudden weakness in one part of the body, or deep comatose stage, patient coming to the casualty with drowsiness. And depending upon the where the tumor is, like for example, brain is divided into multiple lobes: frontal lobe, parietal lobe, occipital lobe. Depending upon which lobe of the brain is involved, patient can have different kind of symptoms. If the tumor is involving the frontal lobe, that's the anterior part of the brain, then they can have personality disturbances, they can have intellectual, they can have speech disturbances. Similarly, if the pain is involving the parietal lobe, that is where we have the motor area, the area which controls our hand and leg movements, the patient can have disturbance in the movements of hand and leg. Similarly, tumor is involving the occipital lobe, that is the posterior part of the brain, then they can have the visual disturbances. And the tumor which is involving the temporal lobe, which is more concerned with this speech, they can have the disturbance in perception of speech or disturbance in word output.